Hi, we're here with Dr. Michelle Bache. She is Vice President, Medical Affairs for Elkhart General Hospital. Dr. Bache, thanks for joining us today.
Thank you.
So this is the third week now that we are updating the residents of Elkhart County about the COVID situation. What are you seeing? What is the latest this week?
So this week, more of the same. Still seeing a pretty steady amount of activity here in the county. I think we added a little over 400 new cases over the past 7 days, which is similar to what we had last week. We're hanging strong at number 4 as far as the number of COVID cases in the state. So still behind Allen County, but still, one of the hotter spots in the state of Indiana.
Okay. I don't want to say what's expected, but moving forward, what advice do you have for residents? I mean, it's good that we are holding steady. That's good news.
Yeah, it's good. It's good news. We are doing a lot of testing, so I think that that's important. I think that testing as many people as we possibly can that have symptoms, so that we can properly contact trace and isolate them and prevent this from spreading even further. We are continuing to notice in our county that our proportion of patients 40 and under who have tested positive for COVID is quite a bit higher than the rest of the state, and in particular, our percentage of patients who are under 20. So I think we had 14.8% of 0 to 19-year-olds. I'm sorry, so of our positives, 14.8% of them were 0 to 19, whereas for the state, it's only 5.4%. So again, I think that that speaks to the manufacturing community that we have, maybe some of these younger people working, and also just being out and socializing more. So we're in the graduation party season, things like that. I think people just need to continue to be diligent and to continue to be safe.
Yeah, because we are in phase 4 in the state, and Elkhart County, of course, falls into that as well. There was no special exception. So talk a little bit too, just about our efforts at Elkhart General Hospital. I mean, there's a lot of people working very hard for our patients. And even as we're seeing hospitalizations, due to COVID-19, we have a lot of processes in place to really keep people
Right.
safe and to treat those with COVID.
Right. So I think that that is kind of a new development in the story this week for Elkhart County, and we are watching this very closely, is the number of hospitalizations of patients with COVID. So we are starting to see that pick up. We are being very diligent with our placement of patients. We are testing not everybody, but anybody who has any symptoms or anybody who has any risk. We're testing them upon admission to the hospital so that we can appropriately cohort them and make sure that we have all appropriate infection prevention measures in place. So we try to keep all of our COVID patients are in special units that are for only the COVID patients, and that allows us to really keep our practices and keep our other patients safe and separate.
Okay, so we'll check in with you next week then again, and hopefully the situation will improve. I don't want to say continue to improve, since things are still, just as you said, holding steady. But we'll check in with you next week and see what the situation is and what the future holds. Thank
Okay,
you.
sounds good, Heidi. Thank you.
Thank you.